another episode. So don't forget, we've been on Everything Health with Mercy, and today we have a very interesting topic today. Yeah, stay tuned. Now let's talk about everything health. Welcome back, guys. So today I would love to talk about the importance of medical checkup. Medical checkup. In fact, I decided to talk about this topic because I need to speak to myself. So it is advised that we go for medical checkups at least twice a year, every 6 months. But I wouldn't push you to doing that because sometimes we stay up to 3-4 years without even visiting the clinic. So I would advise that at least once a year, try to go to the hospital and get properly checked. I mean, we take our cars, we take our vehicles to the mechanic. We don't drive our cars for up to 6 months, do you? So if you do that, how much more your body? Because we're making use of our body. Some of us will work tirelessly. We make use of our body, and yet we do not take it to be properly checked in the hospital.
That one we are not going to tolerate at all. At all.
It is unfair. You're doing yourself more harm than good. Most of us in the UK, it is so difficult to access a medical checkup. It is so difficult. It is really difficult. Where in the UK, we have the free healthcare system, free health coverage. So you go to the hospital, you get treated, you get looked after, you don't pay a dime. But then the problem is the queue. Before you you go to the GP and say you want to be seen, it takes a very long time. For instance, myself, I had a health problem, and I needed to visit the GP. I needed to be seen. I tried calling them. It doesn't work for me. It doesn't work for me. But I just had to keep pushing. In fact, there's an app that will say, okay, you need to make a request on this app, and then someone will pick it up for you. But man, in fact, they told me by 8 o'clock. But before 8 o'clock, while you're trying to log in, they're already telling you, oh, we're no more accepting any more requests. What? What? How do I get checked? So I decided to go to the hospital, to the GP. I decided to walk in. Yeah, I walked in to the GP and said, oh man, I've been trying so hard to get to you to make my request, but I've not been able. So that's why I'm here today. And I went very early, before 8 o'clock. So get this advice from me. If you're in the UK and you need to see the GP, you need to go early to the GP, and they'll get your request. So I went there, told them this is my problem, and they said, okay, we've sent your request and you'll get a call today. And that was how I was being called, and then I was texted, not called. Sorry, I lied. I was texted and to book an appointment for the call. So we had to book an appointment for a week or so after that, just for call. And so it's really difficult to get to the clinic here. But those of you in places where you pay for your services, places like Nigeria, places like the US, it's a bit better. You don't have any excuse. There's no long queue. You can walk into the hospital, especially in Nigeria. You can walk into any hospital, walk into any clinic, and get seen by the doctor. Yeah, apart from the waiting time that day, but you would definitely get seen by a doctor. But it is difficult here. And so let's go down to the importance of having your health checked regularly. There are so many chronic diseases that may not present with symptoms. You may not know, but it's there. So how do you detect it early? It's by going to the hospital. It's by going to get checked. It's by doing your bloods, checking your blood pressure, doing your blood sugar. Those are just important things we need to do. Apart from on your own, I know you're trying. Oh, you say you're trying on your own. I'm eating healthily. I'm doing this. I'm doing that. I'm doing my exercise, but they still need to go to the hospital and get checked. Yeah, guys. So I would advise that every home, every house gets a blood pressure apparatus and a sugar glucometer. In my house, we have it here. So I check my blood pressure, especially when I see symptoms like, oh, I'm being stressed, I need to check my blood pressure or something. I check my blood pressure on a regular basis. So, I mean, you need to get it in your house. Check your blood pressure regularly, your blood sugar regularly. This will detect some, for instance, stroke. Stroke that affects a lot of elderly people now. Stroke. You just see somebody goes down with stroke. Stroke does not come. It's a chronic disease, but it does not come without showing at least one sign. Is it via blood test? You go to and do your blood. Once you do your blood and your bloods are done, they can detect if you are having signs of stroke or if you're getting towards getting a stroke. They will detect it. Yes, they will detect it by doing your bloods. Also, your blood pressure, if it keeps rising, so you don't fall, you need to check. And then when you notice something that is abnormal, you need to reach out to a health personnel. It is important, very important. Don't sleep on it, guys. Make sure you go to the hospital and get checked properly. It is important. I will go, yeah, I promise, I will go. No minding how difficult it is. I will take my family members and we will go. See you next time. And everything health with mercy. Cheers. Bye.